My topic for today's discussion is regarding what is the acute or emergency management of acute or sudden heart failure at home. A lot of people have this sudden episode of sudden heart failure and they are brought to a hospital in a very panicky sort of state. Their bodies are perfusing and their saturation is low, they are panting for breath. And at this point of time, a lot of people do not know what exactly they should have done or they could have done better at home, which could have helped in the survival of their patients. So in this topic, we will be discussing what exactly can be done at home whenever you have a patient of heart failure, and what are the points which can help management of a patient in heart failure in a better way as compared to what is conventionally done when the relatives are ignorant about the management. This is what we are going to be discussing today. This topic is going to be extremely important and interesting for all of you. Coming back to our topic, my topic is regarding what are the emergency management of acute heart failure at the home. What exactly can be done at home whenever you are having a patient with an acute or a sudden heart failure. Now, what exactly is heart failure? Heart failure is a symptom complex where the heart suddenly fails to pump the blood adequately enough to perfuse the entire body, and suddenly the symptoms of back pressure of the blood start to develop. The patient starts to develop pulmonary edema and pulmonary congestion and starts to feel breathless. The patient might be having some amount of chest pain, some breathlessness, sweating, palpitations, lethargy, dropping of saturation. These are the features which might be seen in a patient of acute heart failure. Suppose a patient is having a long-standing heart disease, then this features of abdominal distension and pedal edema, a lot of these things might also be there in that patient. But in acute heart failure, these findings may or may not be there. The patient might be panting for breath, he'll be very dyspneic, there will be a lot of tachycardia, he'll be having increased breath, and if at all you evaluate the patient, you will find that the pulse rate of the patient will be very high and the respiratory rate of the patient also will be very high. The risk factors of heart failure: suppose a patient is having a pre-existing heart failure and he stops his medicines or has a sudden heart attack or some infection or some arrhythmia or something which is suddenly destabilizing the heart. For example, the patient forgets to follow the dietary modification. Suppose the patient takes a lot amount of salty food which is not persistent or not consistent with the condition of his heart. If at all these sort of things are done on a sudden basis, then the heart might go into a sudden heart failure and the patient will land up in the hospital and will require an emergency treatment. Usually this happens in the patient where there are a prior history of heart failure is there in the patient, or in some patients where there are risk factors for developing heart failure, like the patients having ischemic heart disease, diabetes, hypertension, cholesterol related problem, family history of heart problem. These are the risk factors. If present in a patient, suddenly the patient might land up into a sudden episode of heart failure. Now, how do we differentiate it from a patient having a heart attack? Usually a patient of a heart attack will have some features of heart failure also, if at all the patient is having a massive heart attack, but usually pain is more predominant feature. Chest pain is more predominant feature in a patient having a heart attack as compared to a patient having sudden heart failure. Heart failure patient will be dyspneic, he will be having palpitations, some chest pain might be there, but pain will not be the most predominant feature. Breathlessness will be the most prominent feature in a patient having sudden heart failure as compared to the patient having sudden heart attack. Now, whenever we realize that the patient is having a sudden heart failure, what is the basic steps which you should do? At home, you should try to get the patient as calm as possible, because the more amount of mental stress and physical stress the patient takes, the more will be the catecholamine surge or the stress hormone surge in the body, and that will worsen the condition of the heart failure. The patient has to be made in a relaxed position. He has to be asked to sit in the bed until the time the ambulance comes. Of course, the first thing is there that you have to call an ambulance, because whatever be the scenario, ambulance might take at least 10 to 15 minutes to reach the problem area or reach your home. Till that time you have to stabilize the patient. So until the time the ambulance comes, you ask the patient to sit. Avoid getting the patient to sleep, because once the patient sleeps, the gravitational force of the body will cause more and more blood to get accumulated in the lungs, and once the blood increases in the lungs, the heart will not be able to push that blood out and lungs will develop fluid congestion and patient will go into pulmonary edema. So patient has to be made to sit rather than patient having the patient to lying down supine in the bed, or the patient running about all over the place in a panicky or a distress phase, because that will cause more amount of catecholamine surge, that will increase the requirement of the heart in terms of oxygen, in terms of glucose, and that will worsen the condition of the heart failure. So whenever you have a patient of heart failure, get the patient to avoid panic and sit down and relax in a particular area. If at all you have a BP measurement device, you should measure the blood pressure of the patient, because the management strategy of heart failure is entirely different in a patient who is hypertensive and entirely different in a patient having hypotension. Symptoms of hypotension might be that the patient body will become cold, the patient will have hyperperfusion symptoms, patients will have symptoms of increased sweating, body will become cold suddenly, and if at all these things are there, it is really a bad sign, because the patient who is having a lot low blood pressure, the chances of the patient dying suddenly is much higher as compared to a patient who is having a good amount of blood pressure. Or even a patient having a hypertension, maybe the BP might be 180, 190, but the chances of the survival of the patient are much better if the patient is having a hypertension related heart failure as compared to a patient having a heart failure with a hypotension, that means a very low blood pressure. So you check the blood pressure of the patient. If at all you have a saturation probe, you check the pulse rate of the patient and you check the saturation of the patient. If the saturation is low, that is an indication that if at all oxygen is available, you have to give the patient oxygen. If at all it is not available, you get the patient shifted to the hospital as early as possible. You see the pulse rate of the patient. Sometimes the patient will have a very low pulse rate, and you will realize that if at all pulse rate is very low or pulse rate is very high, both of them can precipitate heart failure. So pulse rate at that point of time, whether it is related to heart failure or whether it is a tachycardia or a bradycardia which is causing the heart failure, that also can be assessed if at all you are using a saturation probe, and that will give you some amount of additional information. If at all you have the equipment at home, and if at all you are dealing with a patient who is a known case of a heart failure, if you have the devices available at home and you have an oxygen cylinder, try to put oxygen to the patient. If you have a nebulization device, which is usually a 2,000-3,000 or 5,000 costing device, you can use a nebulization device, and the injections which are available for nebulization, like a beta agonist or and as a cholinergic agonist like salbutamol combination, like a Duolin or a Budocort, you can have at home. These are the common brands. Or you can have a long-acting steroid with a long-acting beta blocker combination like formoterol or budesonide combinations or something like that. These sort of combinations are usually available with people who are having a nebulization kit, and whenever these things are available, you nebulize the patient as much as possible, because whenever the patient goes into an acute heart failure, there is some amount of bronchoconstriction and the respiratory bronchioles also get constricted. So whenever there is some bronchoconstriction, the nebulization will help the patient to a certain extent, and it will push the bronchodilator inside the lung tubules. If at all you just use an inhaler, the chances that the medicine will go inside the lung tubules will be much lesser as compared to the use of a nebulization device. So having a nebulization device at a home is quite handy for a patient having a pre-existing heart failure. If at all you do have some paramedical training, or if at all you have someone at the home who has some who's already been a paramedical staff or some previous experience with the work of a medical staff, then a IV cannula should be put to the patient, or a venous cannula should be put to the patient, and the patient can be given some injectables also if at all that is possible at home. But usually keeping these injections at home is usually quite costly and cumbersome, and a lot of people do not keep them, because keeping them in the home at proper storage conditions is also difficult, and most of these injections have some expiry period also, so keeping them for a prolonged period at home sometimes becomes not very useful for the people, because sudden heart failure might develop, one episode might develop in several years also. So keeping these injections at home is usually not a very practical approach. But if at all you do have a patient with a severe heart failure and you do have some medical training, and there is some person at home who can put an IV cannula, it is always advisable to put it in the patient and give the patient some injections which are available. If at all you have some infusion pumps or BP increasing medicines or BP control medicines are there, that also can be used. For example, if the blood pressure is very high, then you can use nitroglycerin. For example, if the blood pressure is very low, you can use adrenaline or noradrenaline. Although these injection usage is mostly done at the hospital level only, and usage at the home is considered not practical enough. But if at all it is available at home, and if at all some people have some medical or paramedical training, then these things can also be tried. The relatives of the patient of heart failure should also have training in cardiopulmonary resuscitation and the use of a defibrillator device also, if that is available, because several times it might happen that in acute heart failure the patient might suddenly collapse even before the ambulance arrives. So at this point of time, a cardiac massage and mouth-to-mouth respiration or ambubas guided ventilation might be very handy if these devices are available, and cardiac massage should be started as early as possible. Once the ambulance arrives, if at all the defibrillator device is available and the patient is pulseless, then you might have to immediately defibrillate the patient. So relatives of the heart patient should have some basic training in this also, if that is available, because sometimes what happens that the patient might develop sudden respiratory failure when he's roaming around or just he's outside the home, and sometimes in parking lots or in shopping malls or in with the traffic police, these defibrillation devices and kits are available, especially in the Western countries. In Indian scenario, this is not so commonly available, but in the Western countries, these are very commonly available. So the relatives should have some training in the usage of this device, and if at all the patient is pulseless and has suddenly collapsed, then you can make use of this device, and this can be really a life-saving measure if at all. It's although very simple to use, if at all you have only seen a video of it, or if at all you have only used it once, or you have seen a demo also of using it once ever in your lifetime. It's very simple to use, but only thing is that relatives should be prepared to use that one if the facility of that is available. If at all the patient is you are having some oxygen cylinder, then that should be applied. And always whenever the patient is having acute heart failure, if at all an IV cannula is available, you can give the patient some loop diuretics like Lasix or furosemide or torsemide. That can help in increasing the urine output, and that will help in allaying the respiratory distress of the patient before the ambulance arrives. Although again, as I said, that the use of injections at home or a domiciliary setting might be usually very difficult. People may not have the necessary training to use it and might commit a lot of mistakes in the panic setting. Once these injections are given and once the patient ambulance arrives, it's always advisable to call for a cardiac ambulance only, because a cardiac ambulance will always have the facility of a paramedical or a medical staff. It will have a ventilator facility, it will have an infusion facility, and it will have a monitoring device, it will have a defibrillator device. So if at all you are calling for an ambulance, always insist for the calling of a cardiac ambulance, because that will help in shifting the patient, and any problem during the course of shifting might be tackled much better in a cardiac ambulance as compared to a non-cardiac ambulance. If at all the hospital is close by and there is a significant amount of delay in bringing the ambulance, then of course it is much better to shift the patient in your personal car only, in the back seat. The patient should not drive the car, the other person should be driving the car, and the patient should be in the back seat, lying down supine or lying sitting there comfortably, and the patient can be shunted to the hospital as early as possible. Ideally, he should be shunted to a hospital where there are ICU facilities and ventilator facilities, or hospitals where a cardiologist is available. Even if the cardiologist is not available, some physician should be available at that center, because emergency respiratory distress related patients might require mechanical ventilation. So that facility should be available, because if at all you take the patient at a center where that facility is not available, then when the condition worsens, then patient will be shifted from that hospital to another hospital, and that decision might prove very costly, and the condition of the patient might deteriorate in the shifting process. So always select a hospital where the cardiac related facilities are always available. In case of emergency, you can give blood thinning medications to the patient, like aspirin, clopidogrel and statin can be given to the patient, especially if the patient is having chest pain, because it can be presumed that it is a heart attack which is causing this heart failure. So you can give the patients aspirin, clopidogrel and statin. Aspirin 300 milligrams can be given, clopidogrel 300 milligrams, 600 in some cases, and statin, atorvastatin 80 mg and rosuvastatin 40 mg, either of them can be given. Sorbitrate sublingual tablet, if at all the blood pressure is on the very high side and you think that the patient is having some ischemia related problem, you might give it to the patient, but you have to be sure that the blood pressure is on the higher side, because if you give that tablet in a patient who is hypotensive, then the problems will worsen and the condition of the patient will rather deteriorate as compared to a condition which will improve. If at all the patient is already on a blood thinning medication, you might give the patient a reloading of the tablet, but advantage of reloading of a patient who is already on blood thinning medication may not be as good if the patient has been taking the medicines on a regular basis. If at all you have Lasix or Diator or urine increasing medicines, you can give it to the patient if the patient is conscious. If at all the patient becomes unconscious, then ideally you should not try to give the medicines, because if the patient is unconscious, there are high chances that during the courses of swallowing the tablets, the medicine might go into the respiratory tract and the condition will deteriorate. So if at all you are having these medicines and tablet, you should give it to the patient until the time he is conscious. Don't try to give these medicines if the patient is unconscious. If the blood pressure of the patient is good, that is a positive sign. If the low blood pressure is there, that will be a very negative sign, and the patient is much more likely to die. If the patient is already having a very low blood pressure and not being able to feel the pulse, then there are very high chances that the patient might not even reach the hospital and might even deteriorate. And the urgency with which the patient should be shifted to the hospital should be much higher in a patient who is hypotensive. If a patient is hypertensive and the BP is high and the hypertension has caused the heart failure, usually the management is very simple and the patient will improve as soon as the patient is given some injections at the hospital. But if the patient is having a very low blood pressure, then the chances are very poor. The urine output of the patient is a very important parameter. If at all the patient has passed some urine, that also should be kept in mind, because urine output is a positive sign that patient has passed some urine, that the patient is not in a kidney failure, because a lot of these patients of acute heart failure might also be in a kidney failure state, and that is a very negative point. This also should be kept in mind, that if at all the patient is passing some urine, that is a good sign. You should not wait for a cardiac ambulance if at all it is taking a too much amount of time to reach to the hospital. Once the patient reaches the hospital, the doctors can manage the heart failure according to what management protocols are there, and they can immediately put the patient in ICU setup. So as I said, it is always advisable to get the patient only in a setup where ICU facilities are there. If at all the patient is having any other symptoms or patient is developed unconsciousness, you have to immediately start cardiopulmonary resuscitation and get arrangement for a defibrillation device as soon as possible. Most of the cardiac ambulances will contain that defibrillation device, and the patient should be shocked as early as possible to restore the rhythm. If at all even 5 minutes of delay is done in restoring the normal rhythm in a patient who is pulseless and BP-less and is unconscious, then the chances of the survival of the patient is very low in the long term. In this topic, we have discussed what is the management of an acute heart failure patient and what are the things which should be kept in mind while shifting the patient with an acute heart failure. I hope this topic was of some clinical interest to you. If at all you are having a patient who is already having a heart problem, this topic is relevant for all of you. If at all you still have any comments, queries, or if at all you feel that I have missed out on some points, please feel free to discuss about them in the comment section below. If at all you have any topics on which you want us to make more videos upon, or if at all you have any patients related issues on which you want us to discuss, you can write to us about them in the comment section, and we will be happy to answer your queries and sort out your problems. At the end, this is Dr. Navin Agrawal, and I thank you all for a very patient listening. The people who are new to my channel, I would request them to subscribe to my channel, as this gives us a lot of inspiration and motivation to continue the channel in future. Thank you.